if I just look for one dentist within 10 miles, I actually get to 98.8%. Under the specialists, I have a 97.3%, and that was the same for UCCI and Delta Dental. I looked at some of the areas where we didn't have participating dentists, and to be honest, I didn't know the names of the cities, and I had to call somebody and say, what's near here? And so, for example, I found 2 cities up near Rockview, one of the prisons. And I just did a Google access using those cities, and I found that there are no dentists. It's 23 miles, according to Google, till you find any dentist. So it's not that there's no dentist, there's not a dentist in the area that refuse to participate, they just don't live there. It's a very rural area. It seems to me, according to Google, to be surrounded by a lot of state parks. So, you know, looking at these numbers, we think that the UCCI provider access is adequate and is good for our members. When we look at the vision benefits, you can see the side-by-side comparison. For standard lenses for less than 16 years of age, there is no change. For those who are over 16, they've requested to move from once every 24 months to once every 12 months. They've also requested for frames to move from 24 to 12 months and to increase the reimbursement from $20 to $40. The other thing that they requested was the reimbursement rates for the lenses to be increased to $30, $45, $55, and $115. When we went back to the NBA and asked them what the reimbursement rates were, we noted that the rates for participating providers are within the range of what the union is requesting. If the union membership or any member decides to go see a non-participating provider, then that's where they have lower reimbursement. But the participating provider, and NBA is probably the largest vision administrator. They're well known in Pennsylvania. They've had PBTF for as long as I'm aware. You can see that the rates that they've requested are within the rates for participating providers. The one that we had some difficulty with was lenticular lenses, and I have to be honest, I had no idea what that meant, and it took a lot of research for us to fully understand it. But it appears that from what we've learned is lenticular lenses are used prior to surgical implant, prior to surgical implant after cataract removal. And according to what we've found, the average cost is $8 to $10. And for the state police, we use Davis Vision. We asked them. They've only had 11 requests for lenticular lenses this year for their entire book of business. It's not something that's large. They thought that maybe the union was talking about something, and I know I'll pronounce this wrong, the phakic lenses, which are used when the eye no longer has a lens. And sometimes this can be seen after a cataract surgery when the member couldn't take a lens for whatever reason, or sometimes you see it as a congenital deformity. And so when we say the $60 to $95 range up there for lenticular lenses, we're actually talking about the aphakic lenses, because we believe that's what they're looking for, because it didn't make sense for the $115 when, according to the vision carrier, it's only $8 to $10. So that's an assumption that we made for this proposal. But looking at what they're requesting for the changes in lenses and the changes in the frames alone, for this unit, we're estimating $1.2 million over a 4-year period. Disease management, the PBTF does offer a disease management program. They've had something in place since 2002, and in 2005 it was relaunched and named as the Get Healthy program, and was expanded to include options for healthy employees as well, not just disease management. It is a voluntary program. Employees can enroll. They take an annual health assessment, and they can earn a waiver of 50% of their employee contribution. In addition to doing the health assessment, the PBTF, through their vendor, looks at claims on a monthly basis. So for example, if I take a health assessment and I say I'm healthy, there's nothing wrong with me, and the next month I happen to go in and buy insulin or purchase insulin, PBTF will pick that up, and they will diagnose me as a diabetic, and I will be identified as qualifying for disease management and being chronic. So you can't just lie to get through the health assessment on an annual basis. We actually do look at your claims. It's a confidential process. Nobody at the PBTF sees how people are stratified. We just know whether or not they took the assessment. Everything is done by the third-party vendor. And each year you're categorized as healthy, which means, at least right now, we don't see that you have anything going on. At risk means either something in your claims or something in the information that you provided indicates that you're at risk for developing a chronic disease, or you can be listed as chronic, which means that we've identified through your claims or through you acknowledging yourself that you have a chronic condition. And based off of those programs for healthy employees, they just do an annual health assessment. For at-risk and chronic employees, they participate in telephonic programs. For our disease management, which is the biggest component of Get Healthy, it's where you see your largest savings. We do offer programs for asthma, COPD, congestive heart failure, coronary artery disease, diabetes, and low back pain. We also offer a smoking cessation program where members can simply call up and they can ask for an 8-week supply of nicotine patches or gum. That's a free program. They get 4-week program, then they call in and they can get the next 4 weeks. We don't just send them 8 weeks at one time. And they have telephonic support through that program. I thought it was ironic as I walked in the door this morning and standing outside all the people that were smoking. And I won't say that they were members or people in this room, but there were a lot of people outside smoking. And as I walked in, I thought they need to participate in the Get Healthy program.
That's a conference around them.
Yeah. I said I didn't know where they were from. I just said there were a lot of them outside smoking. I see it every day when I walk into our buildings and the people who have to hide outside. And as I walk through the cloud of smoke, I always think about stopping and letting them know and reminding them that Get Healthy offers a smoking cessation program. It is a great program. It offers telephonic support to them. They can take advantage of it, and it's free. So, you know, being a non-smoker, to me, why not take advantage of it? If we look at the Get Healthy financials incentives, again, I talked about the PBTF offers a 50% reduction in your employee contribution. So instead of paying 3%, you take 1.5% of your pay if you participate in the Get Healthy program. And again, for healthy employees, it's an annual assessment. It's very easy. At-risk or chronic employees, they do participate in a telephonic program. And I pulled on the right side, you can see the PSCOA's participation rate over the last 4 years. It has gone up. They're right now, or as of December 31st, they were at 43.4%. Unfortunately, I can't pull the PBTF's data from the same time period because I don't have access to their records, so I had to use reports from boards. So I tried to match it up as close as I could. But you can also see that the PBTF's numbers have increased from 41% up to March, and it's about 65.5%. The latest that I've seen, we did offer a health assessment in March and April, is that the PBTF is going to hit 70% this year, participation rate. I don't have the PSCOA specific numbers because this was just preliminary aggregate data, so I don't know if PSCOA's numbers will increase after April's data or not. We look at the PBTF's Get Healthy program and we talk about the financial incentives, but it's also important to know the savings that we get from this program. And we show there that this savings saves about an average of $164 per employee per year. So you talk about real dollars, that's about $13 million a year we save through this program. If I take that down to a per month, it's about $13 per month. If I go back and I use dependent numbers, including basically every active employee and dependent, it's actually about $5.80 per member per month that the PBTF saves through this program. And from what I've seen, that's a pretty good return on investment compared to some other programs. The PBTF does not offer a health reimbursement program. When you look at what the PSCOA has proposed, they're requesting $600 health reimbursement account for their members. We looked at the $600, and then for an administrative fee, we used what the state police has, and we came out with a $26.7 million cost over the next 4 years. We looked at and tried to find statistics on how many employers offer a PPO and a consumer-driven health plan. And we honestly couldn't find statistics on that. I'm not saying that they don't exist, I'm just saying we couldn't find statistics. Any reports that we saw talking about a PPO for benefit design and things like that didn't include information on the HRA. So one of the things that we did do is go out and look at some of the other states, and we found 4 states, including Pennsylvania, that do offer health reimbursement accounts. But it's important to note that in each case, it's offered with a consumer-driven health plan and not with a PPO. This PFM is a consulting group for us that went out and did the survey on this plan. We wanted to start talking about what our proposals are for healthcare and comparing them to what the union has proposed. For the employer funding for the PBTI for the next 4 years, the Commonwealth is proposing $370 in the first year, $390, and then $410 in the last 2 years. For employee contributions, for the first 2 years, we're proposing no change. That means that there would be a 3% employee contribution without the waiver and a 1.5% contribution with the waiver. And for the dependent and plan buy-ups, for those who are hired after August 1st of 2003, that would continue to apply. For the last 2 years, we're implementing, or proposing to implement, a 3-tier structure, recognizing that there are single versus family contract differences. And so we're proposing to go to a single, a 2-party, and a family rate of coverage. The employee contributions would be based on a percentage of premium, and the contributions would increase annually at a rate of no more than 50% of the premium increase. The annual increases will factor in salary and out-of-pocket costs. And I have a handout that will show you this in a little different. By 17-18, or really over the next 6 years, we're proposing that the employee contributions would raise to 20% for single, 25% for 2-party, and 30% for family. And that's as a percentage of premium. Just as an illustrative, I show on the next slide, right now, for example, for a single party, in 2011-12, their cost would be $28 to $83.69. The varying is based on the fact that a single employee who is enrolled in an HMO doesn't have a buy-up. And I have a waiver. If I don't participate in the Get Healthy program, I'm paying 3%. If I enroll in the PPO plan, I pay a buy-up. So that's why you see such a large difference. The minimum rates are showing someone who participates in the Get Healthy program, and for the post-H-1 hires is enrolled in the HMO. So you see the difference. When we go to the 2 out years, you can see those rates changing to $41 or $46 flat rate, and you can see for the 2-party and the family rate. So it is increasing. And do we have the handout? I know this is confusing, so I just wanted to provide you with a handout that shows this.
Thank you.
On the first page at the top, you can see the current plan design and contributions at $400 per employee per pay for all years.
Excuse me, Tara. Why are we talking about 400 versus 440 right now?
We used an average for the PBTF and whole, so we used $400. We didn't break out the PSCOA to show them differently. I don't believe in this model.
No, I think my question is this: is anybody, any union, except for AFSCME, not getting 440?
I don't know what other unions are paying. I know AFSCME is at $400, but I don't know the answer to what other unions are paying $400. I don't have a list with me. Sorry. Under the proposal, you can see that we're showing the employer contributions going from $370 to $390 and $410 thereafter. And it shows the opening and closing balances under this. You can see for the medical and the prescription plan design that this assumes no plan design changes. You can see in the